how for many years in society it was about weight. Physical activity is what you need to do to maintain a healthy weight. And I would say, I think over the last 5 or 10 years, realizing that your muscles aren't just dumb muscles sitting there, they're also important for your hormones and all kinds of communication molecules around the body. And then yesterday, I was watching this beautiful 30-minute video on your YouTube channel about bone.
Yes.
And I was thinking, this is the same thing with bone, right?
Yes.
Like muscle has had a PR job over the last 5 years where we now understand that muscle is important for so much more than our physicality.
Yes.
And I feel with that video and in this book, you're almost giving this kind of new marketing to bone, saying, hey, bone isn't just your structure.
That's right.
Bone does so many other things.
Absolutely. And I'm so glad you're giving time to this on this podcast, because it is now a vision and mission of mine to help people understand and care about their bones. I mean, it's Fashion Week and around the world right now, and that's about the only time we think about bones is, oh, gorgeous cheekbones, look at our wrist structure, or when we fracture, obviously. Bones are seemingly silent until they break, and then they're screaming because that's excruciating. But the reality is, bones have so many functions in the body from structure. Sure, they're structural. Otherwise, think about it. I love to say this out loud, that without bones, muscle that we're all in love with is just this heaping pile of metabolic tissue like a chicken breast on the counter. It does nothing but lay there. But with bone, you have structure. It gives you human form. It gives you locomotion. But it is a master communicator. Bone produces a multitude of hormones, one of which I talked about on that video you're referencing called osteocalcin. Yeah. Osteocalcin is released by the bone. It goes to your brain. It causes your brain to secrete bone-derived neurotrophic factor, which builds better neurons. So bone is helping you build a better brain, yes. It goes to your muscles and helps with glucose absorption. It goes to your pancreas for insulin release and resistance. In men, it goes to the testicles and helps you produce testosterone. There are bone-brain axes. There are bone-gut axes that are only being worked out. And not only do they talk to the rest of the body, but they are intimately talking to muscle and fat because the musculoskeletal system, fat, tendon, ligament, bone, muscle stem cells are all from the same stem cell, originally the mesenchymal stem cell. They're all cousins. Why wouldn't they talk to each other and do so in a way that coordinates the whole body? And so not only is it a structural master communicator, it is the storehouse of all the minerals we need for our body to function, the calcium, the phosphorus, a lot of collagen. Bone is made out of collagen. When your body needs it to live, it will take it from the storehouse. It's not abnormal to resorb bone. What's abnormal is a disconnect between reabsorption and rebuilding because we use the products we store in our bone. It is also, believe it or not, the incubator of all of our blood cells. All of your blood cells are made in your pelvis and when you're young in your long bones. So if we were going to do a stem cell therapy on you, we would get your stem cells from your pelvis. Isn't that fascinating that bones are doing all these things? And listen, if I were designing a human being, why wouldn't I make bone the master communicator? Because we have bone from the top of our skull to the bottom of our pinky toe. It's a highway for communication. But you're right. We never think about it unless we're thinking about fracture. And it's funny, people say bones are silent. Bones are not silent, but we just can't hear them until they break. And I'm going to tell you from being in the trauma bay many years, it's excruciating and I never want someone to have to deal with it. But we think about it, especially bone health with aging, because as we lose our bone density and break big bones like the femur, or, the top of the femur is the hip, especially in women, men break their bones too. Let's just talk about this. 2 million men in the United States have osteoporosis. It's not just a disease of women, but more prevalent in women. 70% of all hip fractures, which is the biggest bone in the body, happen in women. The instant, literally the instant, snap your fingers, the instant you break that bone, you have a 30% chance of dying in the next year. I mean, that's grave, isn't that? That is a grave statistic that if we could think about our 12-year-old and our 17-year-old daughters that we have, to get their bones so strong at peak mass that they never reach that point.
Yeah.
So 30% of the time, Aunt Miriam, who's a story I told to the FDA in the United States recently as we're trying to change the thoughts about estrogen, 30% of the time she's going to die. And if you live 50% of the time, you will not return to the home that you came from because you don't have the functional strength or you can't get up from a chair anymore. So that kind of fracture is not only a personal pain, it's a family and social dilemma. What do we do with mom, right? Do we hire a full-time caregiver? That's expensive. Do we have her move in? In some cultures, and I'm Chinese, in my culture, that's what would happen. Mm-hmm. I mean, my parents live with me because that's just what we do. But in many cultures, that's not what you do. You find a place for your parents to live. Well, if you find a place for your parents to live, that is prohibitively expensive, many places. And so in the United States, you must use your life savings to pay for that at the rate of $5,000 to $15,000 a month until you're a pauper. And that's when the Medicaid, Who wants to be in that situation?